As a certified personal trainer, the Aimsworx myofascial self-care program is such a valuable specialty to become certified in. From an overhead squat assessment with our clients, we can observe muscle imbalances and myofascial restrictions that need therapeutic self-care. For instance, when we are doing an overhead squat assessment with a client and we observe that their arms fall forward with their trunk, we know that they have some myofascial restrictions in that latissimus space that need therapeutic self-care recovery work. In another instance, during an overhead squat assessment with a client, if their knees externally rotate when they squat, we know that the lateral line of the leg is overactive, so we need to address that imbalance with myofascial self-care to the IT band and also glute medius. So, the dysfunctional core posture patterns of lumbar lordosis and thoracic kyphosis can both be addressed and alleviated with the Aimsworx myofascial self-care program. Whether a client has anterior pelvic tilt or posterior pelvic tilt, they still need Aimsworx decompression. The direct acupressure touch from the knife edge of the bilateral symmetry provided by the foam rollers relaxes the muscles of the spine to create better posture. The lateral line of myofascial connective tissue is key to fixing all muscle imbalances. The lateral line acts as a brake from the imbalances of the anterior and posterior chain. Therefore, it is key to alleviate the myofascial tension from the compensatory imbalances along the lateral line. The lateral line needs the right foam roller to provide the therapeutic touch for myofascial release. This is part of the reason why I designed the Aimsworx foam roller with this feel. Another big reason why I designed the Aimsworx foam roller the way I did is so the size and density fits in the lumbar curve of our spine. Most foam rollers are much too big to try and use for bilateral symmetry and decompression. The last big concept the Aimsworx foam roller was designed with is to be the right feel and size to fit directly down your spine in between our scapula and provide that chest opening stretch. All of my clients who try this with the Aimsworx foam roller compared to the generic foam roller see much better results. Let's start a quick overview of the Aimsworx myofascial self-care program and why it is so beneficial with the T-mobility sequence. With the T-mobility sequence, we place one vertical foam roller directly down your spine, and then we have two horizontal foam rollers. The first one is placed right at our iliac crest, and the second one is placed right at our sacrum. What this sequence does is provides therapeutic touch directly to the spine in between the scapula, promotes an opening of any kyphotic posture or forward head posture, and then with the horizontal foam rollers, we are able to support the hips and SI joint as we create some side-to-side gentle relaxation and massage. This is the easiest sequence to do with your clients to start to get them used to the 3 foam roller approach and why it is so much different and valuable than any other foam rolling program out there. Next, with the Aimsworx myofascial self-care program is the decompression technique that I always talk about. With this technique, we have 2 vertical foam rollers placed down your back and then 1 horizontal foam roller placed underneath your knees. Now, the decompression technique is so valuable because not only is it a therapeutic sequence, but is also going to be a diagnostic test for how healthy our client's spine is. For example, when we start with the foam roller pressure and the knife edge of that bilateral symmetry low in the lumbar curve, it's going to give us a big indicator on how much their spine can open up into lumbar extension. Now, if they have rotation and compensatory problems above their lumbar curve, sometimes this can create pain. A good rule of thumb for the decompression sequence is if a client can breathe through the tension, then it's not too tight. But if they can't breathe with comfortability than it is too tight, we need to move the knife edge of the bilateral symmetry up their spine onto a more comfortable spot. This is where the decompression sequence becomes diagnostic. We can actually start to determine where their vertebrae have rotation and myofascial restrictions that we need to open up. So for a lot of my clients who have really bad lower back pain, when we have the knife edge of that bilateral symmetry too low along their spine, it creates too much pain. So the goal is to start higher up on the spine with the knife edge of the bilateral symmetry. And then as we do the decompression technique with the straight leg bridge, march, and bent leg bridge, we can begin to loosen up those compensatory patterns along their spine and lower the bilateral symmetry of the acupressure touch. We can really tell our clients are starting to get a healthier spine when we move the foam rollers lower and they no longer have pain problems. Another big part of the decompression technique and how to do it safely and effectively with clients is making sure we pay attention to the cervical curve. Sometimes the problem is not actually in the lumbar curve, but it's higher up in the thoracic region. And this is created from compensatory imbalances between our neck and shoulders. With these clients, when we do the decompression technique, it's very helpful to have a pillow or a pad or something supporting their neck. Over time, when we do the decompression sequence, we can remove the pad from their neck, and we know we're starting to get better spinal health in that thoracic and cervical region. This is also going to help us relieve any myofascial restriction below the chain towards that lumbar curve. With this approach, we can really create spinal hygiene and self-care for our clients to promote better relaxation and posture, which is going to create better movement performance through our workouts. Next, let's talk about the Aimsworx glute acupressure technique. Now, the reason I don't like to foam roll your glutes is because from that kneeling hunched over position, we're not allowing all of our muscles to relax. When our clients lay on the floor for the Aimsworx glute acupressure technique, we take two vertically stacked massage balls, we place them in the upper outer corner of their glute and iliac crest. So it's not above our iliac crest, not below, and we're not aiming for our hamstring. So I don't want the client to lift their hips and place the massage balls under their hips. What we do is we rotate the hips away from the focus side. We place the massage balls, the first one in that upper outer corner of our glute, the second one right below and maybe slightly medial to the center. Once we have the massage balls in place, we're going to externally rotate that knee and let our knees fall to the focus side. So this is going to place acupressure touch right in that glute and femur socket, and it's going to be able to provide myofascial self-care to our piriformis, our glute medius, and the whole hip girdle. Another reason why the glute acupressure technique is better myofascial self-care is it's going to help promote relaxation and eliminate stress. Whenever our body is lying on the ground, instead of in a kneeling hunched over position, it's going to promote better stress relaxation because we're relaxing our spine on the floor. Now let's talk a little bit about what it means to hydrate our fascia. So the way our fascia works is like a sponge. When we apply pressure to the fascia, it's like squeezing the sponge. When we take pressure away, it's like releasing the sponge, and it's going to promote fresh circulation, fresh blood flow, and we're going to help eliminate cellular waste and toxicity. So with the Aimsworx Myofascial Self-Care Program, as we're massaging our legs, we have 3 foam rollers to promote better support and also to hydrate the fascia at different areas where the acupressure touch is placed. The Aimsworx myofascial technique for trapezius acupressure is done with 8 massage balls. Now I do like this technique with the acupressure massage balls for pinpoint pressure in our shoulder better than foam rolling our upper back and thoracic region. And I'll show you why. With the Aimsworx technique, we have a square of acupressure placed for each scapula. So we have 4 massage balls in one shoulder, 4 massage balls in the other, with space in the middle for our spine. Now that's key to have the space in the middle for our spine. With the Aimsworx acupressure placement, we are aiming for superior and inferior acupressure on the medial border of our scapula, and also superior and inferior acupressure on the lateral border of our scapula. With the acupressure shape in place, when we open up and adduct our arms, it's gonna fit right in that posterior rotator cuff. We're gonna be able to get some great tension relief with the therapeutic massage balls and the acupressure touch in that scapular region. The only challenging part, if you're doing this by yourself, is setting up the balls, which really isn't that hard. Check out the Aimsworx video and I go over the technique with this. As an Aimsworx certified professional, when you're working with your clients, it's so easy to place the massage balls and have them lay down. So again, I would take 4x4 square for each scapula, place that with space in the middle for their spine, have the client lay back, make sure that they're in the right spot, and then it's a small range of motion as we push and massage and we wash and hydrate the fascia in our scapula acupressure points. Between the Aimsworx shoulder acupressure sequence, foam rolling our pec and our lat, we create a complete pain relief protocol for upper body and shoulder girdle tension. This is why the Aimsworx myofascial self-care program provides better myofascial self-care, because we have the tools and the acupressure touch to fit in the right spaces that are going to promote stress relaxation and better myofascial self-care. Moving on, let's talk about the Aimsworx foam roller technique for our oblique and QL. Now this foam roller technique is not for beginner clients. It's a very deep pressure, but when we take the pressure away, clients notice a great opening in our hips and much more balance and restoration to their movement. With the Aimsworx oblique technique, we have a client lay on their side body and the foam roller is placed right above their iliac in between their ribs. Now again, this is why we need the Aimsworx foam roller, because many other foam rollers are too big or too hard to fit therapeutically in this space. With the Aimsworx foam roller placed in this posterior oblique space, we don't roll the foam roller up and down, we more rotate our body to use the foam roller tension to open up this rib and hip space to get a deep massage for our posterior oblique into our QL. So with this technique, as we rotate the pressure towards our lumbar, we make sure not to go directly onto our lumbar. So I instruct clients, it's a quarter of a turn, so the pressure is still lateral, it's just a little bit more posterior lateral. They're gonna lift their hips to take the pressure away, place their hips back down on the ground to reapply pressure, and then roll towards their belly. As we roll towards their belly, that's what's gonna get this QL to open up and release. The Aimsworx oblique technique and QL release gives our clients some of the most bang for our buck if we're able to comfortably and therapeutically get in this hip space. Some of our clients are too tight, and it's up to you as the Aimsworx certified professional to deem when they are ready to try this technique. With the Aimsworx technique for our inner thigh line and our adductors, it's a difficult technique to instruct our clients to get into, but with enough practice, they can really do a lot of good in opening up their mobility, but also providing lymphatic flow and drainage to this hip space. Now the inner leg line is a very sensitive line, obviously, so we know we need a more therapeutic touch. With the foam roller placement, as we're rolling our hip adductor and inner thigh leg line, you need 3 foam rollers. So this is one that we cannot do with only 1 foam roller, and that's because of the pin and stretch concept. So as I'm instructing the client to foam roll their adductor, they're gonna lay on their belly, okay? With their belly relaxed on the ground, we have 3 foam rollers off to the side of their lower body. The first foam roller goes in that inner thigh and groin crease. The next foam roller is above our knee, pinning our adductor. And the final foam roller supports our ankle at its medial arch so it can massage inside. With this setup, we are pinning and stretching that inner leg line, and with a small range of motion, we're able to create myofascial release at some very key areas that rarely get a chance to have massage or be opened up for mobility purposes. Now, the Aimsworx adductor technique isn't for beginners, and it's up to you as the Aimsworx certified professional to deem when they are ready to move on with their foam rolling practice. It's not really a matter of core strength, but more about body awareness and how to place the foam rollers at the right locations while we relax our hips and provide movement for the myofascial self-care with our upper body. Check out the Aimsworx technique for the hip adductor release, and we'll explain more of this. The reason why it's so important to provide myofascial self-care to our oblique space and also our inner thigh line is because there's cross compensation from our inner thigh line to the opposite internal oblique, which is gonna most often create imbalanced tension and back pain. So with my personal training clients, sometimes the key to relieving their back pain is not working directly with the decompression, although that's helpful, but to provide total pain relief, we must work that deep lateral line and the contralateral inner thigh line, as that creates the oblique sling and the functional kinetic chain of our core. Finally, let's talk about putting all these Aimsworx techniques to a pain relief protocol for our clients. Let me give you some examples of common postural problems that we see and my most recommended Aimsworx myofascial techniques to deal with the tension imbalances and pain. For anterior pelvic tilt or lordosis, the most common techniques that I will treat my clients with are the Aimsworx glute acupressure technique. We're gonna foam roll their IT bands and their quads. We'll do the Aimsworx decompression technique to relax those vertebrae muscles. And then we're also gonna do the Aimsworx oblique and QL technique to help release that tension in our hips and restore some balance to our lumbar posture. How about with posterior pelvic tilt? Well, I still would recommend the client is gonna do the Aimsworx glute acupressure. This is the best technique for any kind of hip tension and pain there is. Oftentimes we do see sciatic nerve issues with posterior pelvic tilt, so the glute acupressure is going to be another great technique for this muscle imbalance. Along with the glute acupressure, it's important to do a decompression technique to start to provide some length to that lower lumbar spine and restore balance to that posture. We're going to do the Aimsworx oblique and QL technique again because that's some of the most helpful myofascial self-care for any hip compensation. And then last, I'm going to recommend the Aimsworx T-mobility technique because the side-to-side rotational massage is going to help release some of those muscles that are holding that posterior pelvic tilt in place. Next, let's talk about kyphosis patterns and thoracic restriction. For thoracic restriction, my favorite is obviously the T-mobility sequence. So that's where I would have anybody start that has a kyphotic pattern. Next, dealing with their upper body, we're going to do the Aimsworx foam roller release for that latissimus and also the foam roller release for their pectoral. Relieving all of the tension in the shoulder girdle that's holding that kyphotic pattern in place is going to be key to restoring posture in the upper half of our body. In addition to these techniques, we still do the Aimsworx decompression technique, but we're gonna focus the knife edge of that bilateral symmetry more in the thoracic region instead of the lumbar region. So what that means for you as the Aimsworx certified professional, when we place the vertically stacked foam rollers, we don't wanna start so low with the acupressure in their lumbar region. We want to move those foam rollers up their spine so the acupressure actually hits in that thoracic region. Now, depending on how bad their kyphotic pattern is, determines how high up in the thoracic spine we need to start. Over time, as we do the Aimsworx techniques to release all this tension, we're going to see a change and a shift in the shoulder girdle. From that point, we can begin to move the knife edge of the bilateral symmetry lower along their spine to begin to create more myofascial release for those erector muscles, and again, be able to create better posture for the upper half of our spine. These common postural distortions that we see as certified personal trainers, we can use strength training programming to work out of and provide better muscle balance and strength. The key with the Aimsworx myofascial self-care program is through releasing the tension, we're going to be able to recruit better neuromuscular patterns, be able to build better strength and muscle balance, and overall be able to help our clients live pain-free from healing their postural distortions. This is why the Aimsworx myofascial self-care program is such a valuable specialty to become certified in. We all know how to do the strength training program, but how many of us know the proper programming to promote recovery for myofascial self-care? This is why becoming an Aimsworx certified professional can help create competitive differentiation amongst your peers, and you'll be able to maintain and re-sign your clients longer because they're not only seeing strength results with you, but also self-care, stress relief, posture results with you. Finally, as an overview for all this pain relief, I'd like to give you my most recommended techniques for certain pain problems. Back pain is the reason why I created the Aimsworx myofascial self-care program the way it is designed as it is. My favorite techniques to relieve back pain would start with the thoracic mobility technique, and then we would do decompression. The glute acupressure technique is always essential to relieving back pain and hip tightness. The oblique and QL release is a major pain reliever, so I love to include this in my back pain relief protocol. Relieving the tension in our IT bands and quads, as well as our inner thigh and adductor line. Doing all of these techniques creates myofascial release for our lower body, our upper body, and all of the core musculature in our spine to best help deal with back pain. How about for shoulder pain? For shoulder pain, I love to start with the Aimsworx T-Mobility to provide that opening chest stretch and get some therapeutic touch directly in between our scapula girdle. Next, I would move on to the Aimsworx acupressure technique for our trapezius and shoulder girdle. This is one of the best techniques to help our clients because they're able to feel pinpoint pressure and start to identify tension imbalances in their own shoulders. In addition to those two techniques, we would foam roll our latissimus and our pectoral. With these four techniques, we can provide myofascial self-care along the whole shoulder girdle to provide better shoulder pain relief. How about hip pain or any sciatica pain? I have seen great pain relief results with hip pain and sciatica pain using the Aimsworx glute acupressure technique, so I would definitely start here. In addition to that, let's use the Aimsworx self-care technique for our IT band and quad, as well as our inner thigh and adductor line. And last but certainly not least, let's make sure to do the Aimsworx decompression so we can release any lumbar tension that's holding restriction above our hip girdle. And how about for knee pain? Knee pain has seemed to be an easy one to solve with a combination of strength and myofascial self-care recovery. The main things to hit here is we're going to foam roll our IT band, we're going to foam roll our quads and our hamstrings, as well as our calves. This will provide fascia hydration to all the muscles surrounding our legs and also tension relief for better movement performance and pain-free knees. These are some of my favorite techniques that I use as pain solutions for these specific problems. Once you become certified as an Aimsworx professional, you'll start to learn the best practices to use for which clients and their specific needs. The beautiful part about the Aimsworx myofascial self-care program is just like yoga, it's free-flowing and it's up to the individual to make the most out of their practice. As the Aimsworx certified professional, we are there to guide them on foam roller placement and cue them on how to move and open their breath for best myofascial release. Because of the simplicity and effectiveness of the myofascial self-care program, an Aimsworx certification will boost your business and will make sure you help your clients live pain-free.